Hi everybody, my name is Luke Vance. I'm a sophomore at Breed College, and today I'm going to be talking to you about taking the handicap out of golf. Now, we're not talking about the usual handicap that's involved in golf, but more along the lines of focusing on helping senior citizens overcome their handicaps by increasing and maintaining their physical abilities and even some mental abilities. So, growing old does come at a cost, and as we become older, we stop doing so many activities as when we were younger. And because we stop doing so many activities, it really takes a toll on our heart because we can't increase our heart rate. So cardiovascular fitness is the first one to decrease over time. And because we're not doing so many activities, flexibility and mobility, that really takes a toll because we're not getting as much range of motion and we're a lot more stiff. And when we're stiff, it's really hard to increase our muscular strength, our endurance, and our power. So if we're not using our muscles, if we're not getting a big range of motion in any type of physical movement, that is going to have effect on our strength, power, and endurance. If we don't have strength, power, and endurance, our balance is going to be off. We're going to have no stability. Our core muscles, our stability muscles, are all going to be negatively affected. And also cognition. So mental health and reaction time, it takes a toll as the brain starts to decrease in its abilities as well. So as we have mentioned before, cardiovascular fitness is one of the first things to decrease over time. The recommended amount of moderate exercise for senior citizens, as you can see here, is listed as 2.5 hours. Now the average round of golf is 4 hours. Now we're not walking the whole time, you're not constantly moving, but there is a healthy balance of rest and exercise. And our swings and strokes are explosive, so multiple swings equals explosive exercise. So not only can repetitive explosive motions fatigue your muscles, but your lungs as well. Using your muscles uses ATP. And to create ATP, we still need oxygen. If you don't know, ATP is what we use energy. It is the energy we use in our body. And as we're using our muscles, we need oxygen to create that ATP. So explosive exercise and walking are both tools for cardiovascular fitness. While we're working on cardiovascular fitness, we're also going to be working on flexibility, mobility, and being balanced and stable. In our backswing is a loading phase, and it contains a lot of different contraction and stretch in various muscles. While we improve flexibility in certain muscles, we'll also be able to increase the range of motion. So we're killing two birds with one stone by improving flexibility and mobility simultaneously. We're also doing this during the follow-through. When following through, the patient must be able to complete a swing without losing his or her balance and be able to remain in a stable position after a powerful stroke. But as we work on the backswing and the follow-through, we can't immediately start out with teeing off and using a driver. So we'll have to focus on different types of strokes. We'll have to start with a putter and gradually move from a wedge to an iron and finally to the driver, as the need for mobility increases throughout each type of stroke. Certain strokes call for turning the feet, wider range of motion, and remaining as stable as possible. To have a good swing, it needs to be stable, a fluid motion from beginning to end, in order to make it consistent. Your core must be engaged, and there needs to be a balance of contraction and stretching between specific muscles. So while we work the swing, emphasis on engaging the core is parallel to having a good backswing and follow through in order to stay balanced. So we're engaging the core and now moving towards working on strength. But not only do we need to talk about strength, but we need to talk about endurance and power as well. A lot of people think that muscular strength and power are the same thing, but they're not. Power equals strength plus speed. Strength in the core will help improve flexibility and mobility when rotating, and this allows the patient to accelerate over a greater distance, increasing speed and therefore increasing power. Repetition is probably one of the most important tools of golf. In golf, it takes several strokes to finish a game. In order to play a half of a round, your client must have the endurance to play at least 9 holes and swing multiple times. Not only is repetition important for endurance, but as mentioned before, an explosive motion uses more energy than you think. Doing it repetitively is probably the most important part of improving and especially maintaining your patient's abilities. Going long periods of time without practicing can and will cause you to lose progress. Remembering the form and keeping the specific neuromuscular control is the most important part of growth. Last but not least, golf can be used as a tool to improve cognition, and cognition is crucial in working with patients, especially with senior citizens. Calculating how far away the green is and what kind of club they need to use from that distance exercises their minds a little bit, and they also get their mind working. Say if they're reading the green and they need to know where to hit it, or how hard, or how soft, and where the ball is going to go. Lastly, mental health is such an improvement when bringing senior citizens into golf for occupational therapy. Just the environment, the positive energy, seeing others that are in their position, and being able to relate to others is a really great boost in energy for these senior citizens and our patients that we're working with. In my previous video discussing occupational therapy and working with discus throwers in the Paralympics, I described the SOAP plan. SOAP just stands for Subjective Objective Assessment Plan. The subjective portion of the SOAP plan is observations that are verbally explained by the patient, while the objective portion is the observations that can be measured, heard, seen, or felt. So these are basically just the vitals, like the condition the patient is in and how it affects moving forward. A stands for assessment, interpreting the patient's problems and diagnosing them, also understanding the degree of problems. And the P stands for plan, putting everything together and proposing the best solution to each of your patient's problems. So what the patient has told us, the subjective part of this, is he has lower back pain and poor posture. He gets restless very easily and, quote, used to be quick as a cat, but ain't got it no more. Hopefully we can not get him as quick as a cat, but as quick as possible and make him the best we can be. The objective portion is he is 69 years old. He is 5'10", 175 pounds. He has a weak core from bad posture, and he's a former smoker. So his lungs aren't as healthy as they should be. So assessing our patient. He'll first need to practice the swings at the driving range before golfing at least 9 holes. Flexibility and mobility will be worked on before engaging in tee-off to prevent injury, so working up to the tee-off. And cardiovascular exercise are going to be mixed in regularly with practicing the swing. Once the swing is worked on and the patient has obtained the lung capacity to walk the course without help, he will play the course. And our plan. This is where it gets deep. The patient will meet 3 times a week for 5 weeks, working on different strokes to improve strength, stability, and mobility, while gradually improving cardio. Twice a week, the patient will be prescribed no less than 8,000 steps a day while at home. After 5 weeks of improving the patient's abilities, hopefully we can attempt our first 9-hole game. Now we go in depth with the plan, and this is the fun part. This is where we take action. So in week 1, while we work the putting stroke, this allows us to introduce different types of grips to our patient. It also allows the patient to work on stability and cognition as he attempts to read the green. We'll use cardio as a warm-up and have him walk 1 lap around the course with an assistant nearby. Once the patient gains the stability in week 1, we will move to a greater range of motion with the pitching stroke in week 2. We will also use 1 ball while practicing. This works in extra cardio by making the patient walk to the ball and pick it up. The patient will hit 25 the first day, 50 the second day, and 75 the third. Week 3, we will continue to work on increasing range of motion. This time, we will also work on engaging the core and building strength. The patient will hit 10 balls, walk with an assistant to pick them up and bring them back. He will do it 4 times the first day, 5 times the second day, and 6 times the third day. He will start with a lap around the course and cool down with a lap around the course. So we're gradually building up our cardiovascular as well. In week 4, the change of range of motion is minimal. This week, we start to focus on strength and muscular endurance. A 7 or 5 iron, you have to hit farther than a 9 and 8 iron. So the patient will do less walking between strokes, but will perform more explosive strokes. He will focus on hitting the ball much harder, doing 60 reps on the first day, 70 on the second day, and 80 on the third. His cardio will be before and after the sets of reps, so the patient can focus more on muscular strength. By doing this, we lower the chances of injury by preventing fatigue and allowing our patient to perform his reps correctly. Week 5, we hope to have a full range of motion. After gradually building up to the tee, we should have built up the patient's muscular strength, stability, mobility, and power. Because of the intensity of the stroke, we will only do 50 strokes per day. Week 6 and afterwards, hopefully we can begin playing the game. First, we'll assist the patient and have a golf cart on standby, while he gradually builds up to being able to go the length of 9 holes. Once he's able to play all 9 holes with no assistance for all 3 meetings in 1 week, we will move on to 18 holes. Again, starting with a car on standby and gradually moving to fully independent. So occupational therapy is helping our patients do whatever occupation they would like. But golf is such a great way to get people involved in a new occupation that can help better their social, mental, physical, and intellectual health. It's great for meeting new people, it's relaxing, and some golf courses are beautiful and it can be very therapeutic. It's a way for them in their old age to still be competitive, but in a laid-back environment. It's not very intense, and because it's not very intense, there is a low risk for injury. I really appreciate you guys' time. Thank you for watching this video.